And I think one of the questions that we get asked quite a bit, on our Sports Vision Pros website, as well as, just individually in phone calls to our office is, hey, it looks really exciting, looks really fun to work with a sports team or to be involved with different teams. How do I do it? How do I reach out to a team? Should I call the coach? Should I call the general manager if it's a professional team? My answer, and I think the same from my colleagues, Dr. Horn, Dr. Cunningham here, is, that the athletic trainer is always sort of the top of the pyramid, the spearhead of communication that, all communication that I've ever experienced through every professional team I've had a chance to work with, it always starts and ends with the athletic trainer. So we always kind of make that point of the athletic trainer kind of being your best friend, but also being your major point of contact, communication-wise and otherwise. So you're the athletic trainer. You're the one picking up the phone. If a doc picks up the phone, an eye doctor specifically, and says, hey, I'd love to have an opportunity to meet with you, talk with you, what do you want to hear from that individual that tells you that's worth getting in through the door, and what are you looking for in having that relationship with an optometrist?
Well, I think that one of the most important things is being cognizant of the time that you're calling them, when you're calling them. It's best to call them maybe in the off season or just at the end of the season, or maybe what you consider downtime for us. We're more apt to be able to have the time to discuss, the things that you'd like to talk about. So in terms of being involved, I think the athletic trainer is a great place to start. They're the ones that are they're the hub of the wheel, I guess. And they're the ones that are kind of the gatekeepers to the healthcare of the athlete. Obviously you'll have the physicians that you're working with as well, but they tend to be on the outside of the hub. So I think it's a good place to start. And some of the things that would pique my interest are, that would help pique not only my interest, but the coach's interest, general manager's interest, management's interest, is what can you do for the team, not only from a health perspective, but performance wise. You've been extremely valuable because you've been on call all the time. You've always answered when we called. You've had, great intervention for injuries, eye injuries, and things that we've needed. But you've also really cutting edge and forward thinking when it comes to the performance aspect of it. So having a knowledge base of all of those things and being very thorough, those are the things that pique my interest when we discuss stuff. So.
Well, I think one of the other things is, and to that point, I always educate, look, your first phone call shouldn't be to probably the coach or certainly not to the ownership or front office of the team outside of the trainer. And I think a lot of what we've built over the time that we've had the pleasure of working together, Eric, is a trust, right? Is a relationship that we've built. And that doesn't happen over a phone call. It doesn't happen, over, maybe a preseason evaluation. It comes over time. And I think, that's something that, as trainers and certainly as professional trainers, you have to also wear that hat of being protective of your players. And there's a lot of people that reach out that want to have a player endorse something or, market something or get their picture taken for the wall or whatever. But, what's the best way really for that new doc within your team to build the trust level with you and really show you that he's there for sort of the right reasons?
Yeah. You may have a relationship with somebody else in the organization, but and that's okay if that's the way that you can be involved with sports. But you should always include the athletic trainer. They can make your life very unpleasant if you do an end run around them. So yeah, I agree with you with that. Yeah.
Well, Eric, from the outside looking in, I think one of the things that most people probably don't realize is the athletic trainer is the person that really only gets the confidentiality or gets the unique relationship with the players, that they'll share confidential information that they wouldn't even want to share with coaches or management. And that's sometimes what whether it's the team physician or the team doctors or the trainer needs to know. And also they need to gain the trust of the trainer in order to do so. And likewise, the management trusts the trainer to bring them certain issues that, may not be traded between players and management as well. So one of the things I do want to mention, though, is that, again, people that aren't familiar with the situation kind of that you and Keith have, that's not the norm. I think a lot of what I found is the issue with a lot of the professional teams that I've ever been approached by is a lot of them will say, well, you know, we got a doctor, we got an ophthalmologist on staff, we're good. They don't understand the concept of vision enhancement, performance enhancement, making the players better. They don't even know that that's even part of the game. You know, how do we kind of bridge that with not only doctors, but trainers as well, and let them understand that, you know, just a team doctor has nothing to do with increasing performance per se. That's not what they're medically trained to do. They're there for, you know, blow up fractures and fingers to the eye. And that's about the limit of what their training entails.
Yeah, that's a very good point. And you're right. I mean, Keith and I built a relationship over, you know, 12 years that we worked together. And it isn't the norm. I think when you're talking about the performance aspect, that's an important aspect, and you can also have a relationship with if the coaches know that you are there to help their team win, help their players perform better. They're more apt to be accepting, and that's sometimes the hurdle for the athletic trainer is, how do I get this person involved when we already have maybe somebody on staff that's trained for more of the emergency kind of situation or the maintenance kind of situation that we might have. Keith, what do you think? Maybe you can answer that. It's just
I mean, I think, you know, we've had a fantastic relationship with our team ophthalmologist, and, you know, we work together seamlessly. I think, you know, going back to the trainer being the hub of the wheel, as Eric said, you know, the communication flows through the trainer. So there are certain things certainly more appropriate to put on the lap of the team ophthalmologist. And Derek's point, a blowout fracture, or a player who's interested in laser vision correction, or, you know, whatever it might be. But, you know, we look at it and we kind of discussed it as physical versus functional, right? That the ophthalmologist is really the physical doc that's there for any physical management that needs done with injuries and that sort of thing. And the optometrist is being sort of the functional specialist, looking at maximizing visual performance and potentially preventing injuries, which is another angle we talk about from the vision enhancement standpoint. So I think that's the thing that we have to have, is that communication and understanding that, you know, every team that Eric's ever worked with and I've ever worked with has an orthopedic surgeon, but they also have a physical therapist. They also have a chiropractor. They also have an internal medicine doc that, you know, that do things slightly differently. I mean, we have a podiatrist and we also have an orthopod, right? So, but if they don't work together with the physical functional aspect of things, at the end of the day, we want our players to perform at their best and to stay healthy. And if we're all there for the right reasons, then, you know, there's plenty of, you know, place settings at the table, right? So if we're all working together as a team, we all win. I mean, I think that's the way we approach it, and that's the way I would hope my colleagues go and try to approach it themselves.
Yeah, and it's a new thing. I mean, moving out here with the Utah Jazz, you know, we have some great physicians, eye physicians, and they're just now willingly wading into the waters of vision performance, you know, and you've kind of been, you know, co-sponsoring that a little bit with some of your suggestions about what they could do to increase their exposure to that, et cetera. So you're right. It's not Derek's points well taken. It's not common. And it's becoming more and more common. Specialization, you know, tertiary care, performance bleeding into everything else, sports science and medicine mixing together, performance and medicine mixing together. These lines are all blurred, and they're getting blurrier and blurrier, which is a good thing, because all these disciplines are having to, you know, understand each other, and that makes for an environment that is eventually much more efficient. So there is a place, especially for you guys. This is the uncharted frontier in sports performance is vision, in my opinion, and not only in injury prevention, but obviously, you know, playing better.
Ultimately, Eric, when you brought up the fact that essentially there are no more silos, we're all working together to make sure those athletes get out there as soon as they can, and so those barriers get knocked down, which is what it should be. So that way we are all talking, and that's essentially how research comes about. That's how relationships are developed, and that's how eventually we can help everybody in the league and in various leagues. So now that you know, and to develop that community is such a huge benefit, because that's what we're about, is improving athletes' lives. And
I'm thrilled and excited. This is such an awesome opportunity. I just want to thank you again, Eric.
Thank you. I appreciate it. It's fun to talk.